Good evening to all of you. Welcome back to my channel, The Healing Hands. Today we will discuss about pulse. Now discuss about pulse. Pulse is expansion and recoiling of an artery. It is an indirect indicator of circulatory status. Changes in pulse rate are used to evaluate the patient tolerance of interventions such as ambulation, bathing, dressing, and exercise. Now we will discuss about pulse point and location. Site of pulse. First of all, temporal artery, lateral side of eyes and in front of ears. Carotid artery, grooves between trachea. Apical artery, left side of midclavicular, fifth intercostal space just below the nipple. In children and pregnant women, fourth intercostal space. Brachial artery, antecubital fossa, medial side. Radial artery, lateral thumb side. Sixth one is ulnar artery, medial side of wrist, little finger side. Femoral artery in groin areas. Popliteal artery, popliteal fossa behind the knee. Next one is posterior tibial artery, behind medial malleolus, inner side of ankle. 10th one is dorsal pedis artery, in front of foot. Now we will discuss about pulse rate. Before birth, 140 to 160 beats per minute. After birth, 120 to 150 beats per minute. Infants, 110 beats per minute. Children's, 90 to 100 beats per minute. In adults, 60 to 100 beats per minute. Old age, 60 beats per minute. The average adult pulse rate is 60 to 100 beats per minute. Changes in pulse rate used to evaluate the client tolerance of interventions such as ambulation, bathing, dressing, and exercise. The heart rate is slow with age. Exercise increase the heart rate. Emotions stimulate the sympathetic nervous system, increasing the heart rate. Pain increase the heart rate. Increased body temperature cause the heart rate to increase. Now we will discuss about abnormal pulse. First of all, bradycardia, pulse rate below 60 beats per minute. Tachycardia, pulse rate more than 100 beats per minute. Example, hypertension, congenital heart disease, trauma, brain injury. Bounding pulse. A bounding pulse is a strong and forceful pulse that quickly disappears. Example, hypervolemia and overhydration में हमें bounding pulse सुनने को मिलेगी. Steady pulse, weak pulse difficult to feel or obliterated easily with the slight pressure. For example, hypovolemia, dehydration. Fifth one is dicrotic pulse, single heartbeat but double pulsation, twice beating. For example, low cardiac output में हमें dicrotic pulse सुनने को मिलेगी. Sixth one is Corrigan pulse. Corrigan pulse को ही water hammer pulse या collapsing pulse पे बोलते हैं. A pulse that is forceful and then suddenly collapse. Forceful and rapidly increasing and subsequently collapsing, as if it were the sound of water hammer. ये साउंड हमें aortic regurgitation के टाइम पे सुनने को मिलती है. Seventh one is pulse deficit. Differences between apical pulse and radial pulse. Abnormal pulse. Eighth one is pulses alternance. Pulse with alternating strong and weak beat. हार्ट ब्लॉक और वेंटिकुलर फेलियर में हमें पल्सेस अल्टरनेंस देखने को मिलता है. नाइन्थ वन इज बिगी मिनी पल्स. It is abnormal heart rhythm in which every other heartbeat is premature contraction. First weak pulse, then after that strong or normal pulse. डाइजॉक्सिन टॉक्सिसिटी एंड एमआई में हमें बिगी मिनी पल्स देखने को मिलती है. 10th one is paradoxical pulse. During inspiration, pulse volume is decreased. Less stroke volume, then decreased cardiac out, after that decreased pulse. Thank you for watching. Please like and subscribe for more videos.